It can be an alarming experience when it happens to someone you love while they are in the hospital. Delirium, when someone suddenly becomes confused and disoriented, affects more than 2.5 million Americans every year. Now, a new UCSF study has been looking into what can be done to prevent it. Dr. Sarah Lahue is assistant professor of clinical neurology at UCSF and first author of the study, and she joins us now. Dr. Lahue, thanks very much for being here.
Hi, Kathy. Thank you so much for having me on to talk about this study.
So, doctor, let's talk about delirium, its symptoms, who's most at risk, and why did you embark on this study?
Well, delirium, as you mentioned, is so common, and I imagine that many of the people watching this or listening to this have some personal experience with delirium, either with a family member or friend. I certainly have had that experience with my own family members, and it can be extremely distressing, and for me that was certainly an inspiration to work on better understanding delirium and how to essentially help management and just better understand what's even causing it. So that's a little bit of my background in terms of what inspired me to pursue this area of research. But in terms of delirium itself, as you nicely summarized, essentially what this is someone having a sudden change in the way that they're thinking. They suddenly become confused. They might become disoriented. They might have difficulties with attention, and sometimes it can also change behavior in that people can become either more agitated or even a little bit more withdrawn. And this is something that can happen all of a sudden, and it is something that can wax and wane during a hospital stay, and that's also something that can be a little bit confusing for people witnessing someone who is delirious, because it's not something that is always there. It's something that can come and go, and so for that reason, one needs to be especially on the alert to identify this, just because it is something that can come and go like that.
And your hope is to prevent it. Let's talk a little bit about how the study worked then. You followed a lot of patients. What are some of the tweaks, the interventions you made, and what did you find?
So for many of these interventions, we focused on really simple changes that don't require any medications, things that really can be applied at any hospital that are quite simple, that largely involve routines to help either promote wakefulness during the day or to help promote the ability to go to sleep and have a restful night in the evenings. And so some of those things might include, again, very simple interventions that have a huge impact, that include even just turning lights on during the day, having the window blinds open, having activities for people who are in the hospital, getting them out of bed, having them walk around, interact with staff. So things that can promote just wakefulness and just activity during the day. And then at nighttime, again, simple maneuvers, things like offering tea or relaxing beverages, making sure the TV is off, which is, I think, a really important and simple change that we can make, closing the blinds at night. And so just keeping in mind things that can help promote wakefulness during the day and help promote sleep at night.
And did you actually find that this made a big difference, just these simple interventions?
So we found that these actually made quite a big difference. So with this study, we were able to actually look at how over 20,000 patients at UCSF Health and how they did with this intervention. And so what we found was that even with these simple maneuvers, just a simple intervention, across the whole hospital, this actually provided a great benefit for patients. So what we saw was that with this intervention, those who experienced this intervention, they actually were in the hospital for a lot less longer than those without it. And they also were less likely to be readmitted to the hospital within 30 days.
One of the interesting things I saw is that you found removing bladder catheters and restraints helped prevent delirium. Can you talk about the challenges a little bit there? Because presumably those kinds of tethers were used in the first place for the health and safety of the patient.
So, Kathy, I really appreciate this question because it's very nuanced, and it's something that I have to think about often in the hospital when I'm caring for people who are either at risk of becoming delirious or who have delirium. And as you mentioned, sometimes these tethers are required as part of their care for being in the hospital. They may be required to help essentially keep someone safe, to make sure that they aren't pulling out necessary lines and tubes, or to help them urinate if they are unable to do that independently. So these do have some clinical benefit, but they can also increase the risk of someone becoming delirious. And so what I try to do in part of my practice and what we do through UCSF Health is really thinking about what is the reason for someone to have these tethers on a daily basis and removing them whenever possible, as soon as possible. And for something like restraints, thinking about ways that we can try to limit the need for a restraint with other maneuvers. So either having an assistant in the room with the patient to help redirect them so that they don't need a restraint, and so that essentially helps them from pulling out lines and tubes. Instead, there's someone there who can help redirect them and distract them and prevent them from hurting themselves in that way.
And of course, a lot of hospital protocols changed throughout the pandemic. So how does COVID-19 play into your thinking in all of this?
Right. I really appreciate you asking that. COVID-19 has had a huge impact on the way we care for patients in the hospital. It has also, I think, unfortunately, impacted what we do for delirium in a very important way. It's something that we've been able to establish in studies, including my own work, that COVID-19 does increase your risk of developing delirium, especially if you have severe symptoms of COVID-19. And then it's also complicated by the fact that it does make it harder to actually implement some of these protocols. Thankfully, at UCSF, we were never impacted to the point that we were unable to actually continue with this pathway, unlike other hospital systems. But regardless of that, as part of taking care of someone with COVID-19, there are still systems in place that might make it more challenging to interact with that person, and that might limit interaction and some of the activities that we would want to encourage throughout the day. And so that's one of the reasons why I think COVID-19 had a huge impact, or has a huge impact, on delirium, both the infection itself, but also some of the environmental factors that come with that by caring for people in the hospital with COVID-19.